Yeah. Okay, thank you. Hi, my name is Latoya White, and I'm a member of the Texas Organizing Project. We organize in 3 counties across the great state of Texas. We organize in Houston. We organize in Dallas. We organize in the Valley. I am a single mother of 3 young children, and I live in Houston. April last year, I almost lost my life because I have sickle cell. And because I didn't have health care insurance, I waited to the last minute to go to the emergency room. The doctor told me that if I wouldn't have came that night, I would have died because 3 of my organs had begun to shut down already, and I ended up having to have 2 blood transfusions. There are millions of people right now in the great state of Texas who face the same challenges that I do right now, but I know Texas can do better. Texas has helped other states in time of crisis, but there are 1.5 children right here in the Lone State that live in poverty, and I know Texas can do better. There are over 6 million hard-working Texans like me who don't have health care, and I know Texas can do better. Texas has the highest rate of uninsured people in the nation. Texas is last, and I know Texas can do better.
Hey everybody, give Tanya a big yay! I'm Roland Goertz, and I'm a family physician and the CEO of a federally qualified health center in Waco. We take care of over 51,000 people in our county. 21,500 of those patients are covered by Medicaid. For those, we can provide needed services at a time when we can help with their illnesses and help with their health, not just treat them when they're seriously ill. We can help the children and some of their mothers. We can help those elderly and disabled to have a more dignified life. However, over 20,000 of those patients are uninsured. Some are parents of children on Medicaid. Some are young adults with tough backgrounds. Some are older but not old enough for Medicare. 80% of them work, but they work for employers who do not offer or cannot offer commercial coverage for them or their families. Those people delay needed preventive care and don't regularly treat their disease because they don't have enough money to pay the rent or buy food for their family. Where do we see them? Yes, we see them eventually in the emergency rooms with advanced illness. We see them where care is most expensive. If anyone thinks that is the best place for care, well, they just don't understand health care. They may understand something about illness, but they certainly don't understand health. I understand how critical Medicaid is to patients who have it. I just can't understand why some legislators don't. The current Medicaid program is not perfect. Some reforms to lower cost and a greater emphasis on quality, along with some innovations to improve the patient's own ability to help with their care, are needed. But we don't need to toss out what works. Medicaid expansion is a critical step to providing health care coverage for many who are uninsured. It's a chance for many low-income working adults and parents to get coverage. It's a way to bypass the expensive emergency room and a way to a healthier, more productive life. Study after study after study shows that to be true. Working families deserve better than what they get now. The economics of expanding Medicaid are clear. You don't need a business degree to understand it. It will strengthen local hospitals, save money in local communities, create thousands of jobs, and lead to healthier lives. It is time to change those things in Medicaid that can work better, but it is also time to make it stronger by accepting available federal funds so more citizens of this great state can have the health care they need. Medicaid matters.
Okay. Hello, my name is Denise Sonleiter. My son Maverick is 17 years old. He has multiple disabilities. Maverick receives Medicaid via the Class Medicaid waiver. I am here to tell you that Maverick's Medicaid matters. Services for children with disabilities have evolved over the years. It used to be that parents were encouraged to institutionalize their kids and get on with our lives. For parents who brought their infants home, they soon realized that they need a lot of help for their child and family, but found that the only way to get help and services was via the institutional settings. Well, things have changed. With passage of IDEA in 1975, children with disabilities attend school with their peers. With Olmstead, supports are being developed in community rather than in institutions. Children are living at home with their parents and siblings, and dollars are being allocated to cost-effective community supports, such as Medicaid waivers. Maverick's Medicaid matters. The Medicaid waiver has allowed Maverick to get help with basic, much-needed supports in his own home with his mom, dad, and big sister Ava. The Medicaid waiver has allowed Maverick to live a pretty normal childhood despite his disabilities. He's 17 years old and he's living like a 17-year-old. I'm happy to say that I'm his mother and I'm happy he's living a 17-year-old life. Texas families raising a child with a disability probably look different in some ways than the families that you may have grown up with, but in more ways they are the same. We want our children to have opportunities to live their lives to their full potential. We want our children with disabilities to live meaningful lives in dignity with respect. We want to delight in our children's talents and accomplishments. Yes, it's a big challenge for families raising a child with a disability. Our families want you to know this. We want you to know how hard it can be and why we need help. But we also want you to know that our families are loving and strong. We don't want you to feel sorry for us. We don't want you to put us on a pedestal. We certainly don't want the state to take our children off of our hands. Medicaid waiver services for children with disabilities do not replace parental responsibility, but these services are so important for healthy children and strong families. Maverick Medicaid matters. Thank you.